how you decide, what are your parameters to decide, Baba, yes, this person requires oral contraceptive pills, or this particular person requires condoms, barrier method, or this person requires something like IUCD. हे तुम्ही किऱ्यावरसून ठरवता आणि what are the advantages of that? म्हणजे डिस्कटावून सांगा.
So, Dr. तुम्ही सांगणार तसे. So, every couple has different needs. Okay. So, एक आता client आली आमच्याकडे. Okay. She comes with her husband, or she comes with somebody else, or she comes alone. Basically, आम्ही त्या history taking session and we have a very detailed interaction with the client. We ask her what her contraceptive needs are. So, some women like their husbands are on the ship or they're abroad.
Correct.
So they come here for a very short time. So in that particular time, they are not planning a pregnancy. So short-term contraceptive, like a DMP injection, which is effective only for 3 months, or a barrier, like the condom, can benefit her. Sometimes even OC pills. So combined OC pills, or आमचे ते गर्भ निरोध गुळ्यो असता पळय, those we have to do a little more detailed screening because तांचे खूपशो side effects असता, खूपशो contraindications असता. So never take the OC pill without consulting with a gynecologist. So now if a client comes, we assess what her needs are.
Absolutely.
Now supposing a lady has come, like I told you, ship. So we give her short-term contraceptives. Now there is another lady who has come who wants long-term contraceptive. So तिच्या आता बुळ्या झाला. She is feeding her baby and tika आता काहीच pregnancy ची planning now for the next 3 to 5 years. So for these women, we can give something known as the long-acting reversible contraceptives. Long-acting मुल्यार they act for long durations, not 1, 2, 3 months, ranging from 3 to 7 years.
I see.
Secondly, they are reversible. So supposing 5 years later or 3 years later, she decides ki आता आमका second planning, we want to plan for a second child.
Absolutely.
So that contraceptive is easily reversible and the couple can begin for their second child. So again, somebody who has just delivered, tika at least 3 years of adequate spacings hai, we probably advise her on an IUCD or probably or an implant, which is the new contraceptive that has been launched by the government of India and the government of Goa. So we always assess what the client needs. Then we ask certain questions that help us determine if the client is suitable for a certain contraceptive. For example, OC pills or Chaya, which is a non-hormonal contraceptive tablet. Some women are not comfortable with taking pills every day, which is the biggest problem with the combined OC pill. You have to be compliant, you have to take the tablet every day. Ek tablet chuklyar so there are issues that crop up. There is contraceptive failure, there are period irregularities. So if a woman feels that she's not compliant, she'll probably miss taking a tablet, which, let's be honest, a lot of us are. असले बायलेक आम्ही दुसरे options offer करूंक शकता. Like maybe a twice a week tablet or the Chaya tablet or maybe an IUCD or barrier or maybe even an implant. So all these options are available. So the client assessment is done based on what her requirements are and then afterwards we triage and decide what particular contraceptive will suit her if she has any side effects. Like somebody who's a smoker, somebody who's got hypertension. Tika आम्ही चोड करून combined OC pills दिवची ना. We'll probably advise something else for her. Somebody who is say having multiple sexual partners, you know, not in a monogamous relationship, multiple sexual partners. For such a client, prevention from sexually transmitted infections is very important. So for such a client, we would probably offer her the barrier, a condom. Then somebody who is say, again, interpregnancy. So for these kind of women, IUCDs, implants are very good.